What causes UTIs? Top risk factors explained. Imagine a tiny invasion that can cause discomfort and irritation in your urinary system. Urinary tract infections happen when bacteria enter the urinary tract and start to multiply. The most common bacteria responsible is Escherichia coli, which naturally lives in our digestive system. These bacteria can travel from the anus to the urethra, the tube that carries urine out of the body, and then ascend into the bladder, causing infection. Other bacteria like Staphylococcus saprophyticus, Salmonella, and Staphylococcus aureus can also cause UTIs, but they are less common. Certain factors make some people more prone to these infections. For women, the shorter length of the urethra means bacteria have a shorter distance to travel to reach the bladder. Plus, because the female urethra is close to the anus, bacteria can more easily contaminate the urinary opening. Sexual activity is another big factor. It can push bacteria into the urethra, especially if proper hygiene isn't maintained afterward. Having a new sexual partner or engaging in frequent sex can increase the risk. Using some birth control methods can also influence UTI risk. Diaphragms and spermicidal agents may change the natural balance of bacteria in the vagina or cause irritation, making it easier for bacteria to invade. Hormonal changes, like those during menopause, lead to a decrease in estrogen, which can thin and weaken urinary tract tissues, making infections more likely. Pregnancy also raises risk because hormonal shifts and physical changes can slow urine flow and create a more favorable environment for bacteria. Structural issues in the urinary tract, such as kidney stones, an enlarged prostate, or congenital malformations, can block or slow urine flow. When urine doesn't flow properly, bacteria can settle and multiply more easily. A weakened immune system from conditions like diabetes or treatments like chemotherapy can reduce the body's ability to fight off infections, increasing the chance of developing UTIs. Having a urinary catheter inserted for medical reasons is a significant risk factor because it can introduce bacteria directly into the urinary system. People with a history of recurrent UTIs or those with family members who have had frequent infections may also be more susceptible, possibly due to genetic factors affecting immune response or bacterial adherence. Other factors include not urinating after sex, poor hygiene practices, obesity, constipation, and certain blood group secretor statuses. All these elements can influence how easily bacteria can invade and infect the urinary tract. From a bladder health perspective, preventing UTIs is crucial because repeated infections can cause ongoing inflammation and irritation of the bladder lining. While UTIs themselves do not directly cause bladder cancer, persistent inflammation is linked to increased risk of bladder conditions over time. To protect your bladder health, practice good hygiene, stay well hydrated, and seek prompt medical care if you suspect an infection. Always consult healthcare professionals for personalized advice and treatment options to keep your urinary system healthy and functioning well.